Hello, everyone. This is Tom Fox back for another episode, and I'm absolutely thrilled today to have with me Abby Filyaw and Clayton Evans. Abby, first of all, welcome back.
Thank you, Tom.
And Clayton, welcome to the podcast.
Thank you, sir.
Abby, could you remind our listeners where you guys work?
Yes, we work at the Hill Country Council on Alcohol and Drug Abuse.
And Clayton, what's your role?
I'm a recovery coach.
What is a recovery coach?
Basically, we just help people along their recovery journey, get healthy, stay healthy, and whatever that entails of helping them along their way. The road gets bumpy sometimes, and sometimes they need someone to talk to, financial assistance, whatever they need at the time is what we offer, and we're just there to make it a little smoother.
Abby, we're sitting here recording this today, mid-June, about 11 months post-flood.
Yes.
So how would you assess your world in Kerrville and Kerr County? Are we seeing an uptick in addiction, or is it about the same? Are there mental health issues that a lot of those in recovery are struggling with? How would you assess where we are today?
What I'm hearing from our coalition director is that there is a longer wait list at Hill Country MHDD. So there seems to be more mental health symptoms surfacing. And I hear that social media is one of the major things contributing to more stress, more anxiety among mostly our young people, but adults also. With us, we have continued to see about the same amount of numbers. They say it takes 5 years in order for us to really see the full effect of the rise in substance use, typically after a disaster. So we're just not there yet. We're supporting people who were affected. Most of us, if not all of us, were in some type of way. So we continue to address it in our outpatient groups and things like that, just to give people a platform to talk about what it's like for them when it starts to rain, and then it starts to rain a bit more, and then all of a sudden we're in a flash flood warning again. How are we coping with those types of stressors?
You mentioned social media. Is it something along the lines of people are posting more about potential warnings or potential flooding? Is it people posting about as we come up to the first year anniversary, maybe all of the above, none of the above?
Yes, all of the above. It's just flood related posts starting to happen. We'll get the news crews back up here in a couple of weeks, I'm sure. And how do we as a community take care of each other and not contribute to making things worse for anyone else who might still really be grieving?
And Clayton, from your perspective, I'm in recovery as well, so we're all kind of brothers and sisters here. So I have some appreciation of not only what you went through, but what you are going through in your role. Are you seeing people express anxiety in our community around this, or is it something different from your perspective?
I live in Ingram. I live across Indian Creek, so we're actually flooded in for 2 days, and I think that just everybody's more aware right now, and so now whenever you get a little warning, everybody's, oh my God, it could be the big thing again. And I think that since the actual, I guess, is PTSD from like it actually happened that big, and now when there's rain and then there is a warning, I think people are more anxious, or their anxiety is a lot more high.
I'm of two minds on this. I'm on two minds on a lot of things, but one of me is I do need to pay more attention. And so I appreciate when not simply Weather Service or an official post, but the mayor repost, some of the other sites on Facebook repost. But I'm like you and probably a lot of people, I'm thinking, what do I need to do today? Do we need to think about where we're going? Can we just run up the hill? Kind of all those things that I never thought about before. Is that in y'all's experience, would that be normal?
What do you mean?
You appreciate the warnings, yet you think about, you're taken back to that time. And is this the next big one? And is this going to be something that we all have to live through again?
I absolutely have to do a lot of regulation when we get any kind of rain, to be honest. My anxiety goes way up and my heart starts to beat faster. And I'm like, okay, we're safe. We're going to do some deep breathing. What do we need to take care of today, right now? And then just bringing myself back with some grounding exercises, talking to the people I'm doing group with. So I'm in it with everybody else, learning to relax when we do start to get those warnings. I think we're about to have one maybe tonight.
One of the things I've been thinking about is, has our relationship with the Guadalupe River changed? And for me, the answer is yes. certainly respect, if not fear. But as I will let my wife speak for us, we are never buying a house on the river, period. We're just not going to chance it. And here is something that has been not only physically central to our county, it runs right through our county, but central to our lives. And you mentioned, Clayton, you grew up here and in Ingram, or born here and then in Ingram. What did Guadalupe mean to you growing up in Ingram?
I basically lived on that river, and I've seen a lot of floods since I was a kid. And when the warning came through, we were asleep, and it didn't come through till right before the big flood. They said there was warnings that were sent to other networks, but when my phone went off, I looked at it and it was like 350 or something like that. And I looked at it, and from being here and being through so many floods and stuff, I honestly didn't think that it was that one. And so I looked at it and it was like 350 and I turned it off. I got up at 4:20 and I went outside almost 5 o'clock and it was already coming up the hill. And I was like, man, it's here. So I always respect the river because even if it's not a flood, the river can take your life. And it's I got kids and you got to be aware because it's not even don't even have to be deep. It's just like a bad fall or anything. And like my cousin, he if like I said, we're flooded in and it was a real tragic story. There was somebody that came down and was stuck in the tree and they went in the flood and tried to save them and they didn't get him out of the tree. And so the middle, it's bad on everybody at the end, like the tragedy and just going forward and all that's in your mind now. Will it be that big one coming again? Because you never know, because it really didn't rain too hard right here, right then. And all the people that were here from the 4th of July, they would never, there was no warning to like, hey, this is going to be something coming in this area big like that, or else they wouldn't have been like down by the rivers and stuff.
And Abby, as I recall, you were living on or near the river at that time. And so you personally experienced all of this too. What was it like for you?
We moved just in time, but our river house is still standing. It was up 8 feet from already being up about 10 feet from the actual river where it usually sits. And the house is still there. Everything under the house was gone. The neighbors had some flooding. But this year for the 4th of July, we're having a party at the river house. I love the river. I've always loved the river. And we're on the North Fork, so it's above where a lot of it got really bad. I'm going to still swim in it. I can't be mad at it for too long. It's such an important place to me and my family. And I'm going to play a show on the 4th of July, play some music, and then go have a party with my family at the river house. But there are mixed feelings, obviously, about the 4th of July coming up.
I heard one woman describe or look at it from the river's perspective. And she talked about the damage to the river. And I think we all know about the trees and loss of plant life and perhaps loss of animal life in addition to the loss of human life. And we can still see the damage to the river even right over Sidney Baker. So it's still with us daily and day after day. And one of her points was it will take the river to heal itself before we can heal.
Yeah.
Any thoughts on that one way or the other?
Absolutely. I think everything is connected. So while you're driving past it and seeing the boats and all of that stuff, we're all in this recovery process together. The river being an alive, living thing, such a big part of our community. I think that makes a lot of sense. It really does.
Any thoughts on that, Clayton?
I think that I've been here my whole life, so I don't think that a lot of it's ever going to be like it was before because so much stuff came from upstream. And I like to fish. And a lot of the fish that were here, like the bigger fish, they're not here like that because it's not as deep for them. And all that stuff from upstream came downstream and you would have to dig it all out and it's like certain parts of recovery, but I'll tell you this, that it's never been as clear as far as they wiped out all them woods that were like keeping on the banks. All that's been cleared out. So there's parts when I drive to hunt and I'm like, I've never in my life seen it like that ever. And so it's a change. And I think we just adapt to the change. But I do think that nature just heals itself and it's not going to be the last flood here. That's for sure. We live on the Guadalupe.
You got that right. Abby, let's turn to one of the new initiatives that you and your team are on. Could you tell us a
Okay.
little bit about that?
I would love to. We promote naloxone or Narcan to reverse overdoses. There are a lot of substances now that are at gas stations and other vape stores. There's something called Kratom, and there's something called 7-OH, which is 10 times stronger than Kratom. Kratom is a plant, and it acts like an opioid, and naloxone does work to reverse the overdose. And naloxone only works when there's an opioid present in the system. It's dangerous. It's a dangerous substance. It's very addicting. And the 7-OH is the concentrated version, synthetic, and it's 10 times stronger than the kratom. And people are really suffering withdrawals and having to go to inpatient treatment when they're mixing the 7-OH with alcohol. Sometimes they're dying. We've lost several members of the recovery community specifically this year due to 7-OH mixed with alcohol. We have big purple boxes at vape stores, the lobby of the Kerr County Jail. Hill Country MHTD has one. If you see a big purple box, it's called a Barney. And I was at first, I was like, is that what we're calling them? But that's what the website is calling them. And you know what? They're big, they're purple, they're Barneys. I'm good with it. But it took me a minute because I'm like, are we trivializing life-saving medicine?
No, I think it's actually perfect. Even I knew what that meant.
There you go. See, and I've come around to the Barney idea. We're going to put some stickers out that say, share your life-saving naloxone story, because I want to hear the stories about people's lives getting saved and then maybe what they went on to do afterwards. I witnessed an overdose when I was driving someone to treatment and they became a firefighter. So I just want to instill hope, and I want to promote the public health initiative of getting this substance into the community so we can reverse some overdoses. Naloxone is Narcan. Narcan is naloxone.
Has the local law enforcement community, both in Kerrville and Kerr County, been supportive of your efforts?
Absolutely. I am so grateful that we got a Barney put in the lobby of the Kerr County Jail. Most people are at risk for overdose when leaving inpatient treatment or incarceration because they've lost their tolerance. So when family members go visit their loved ones that are maybe in the jail, they can pick up the naloxone in the lobby. When someone is leaving their stay, they can go pick some up. And our recovery coaches are now visiting those who are incarcerated because we have a partnership with the public defender's office now. So we're trying to get them in there to promote recovery and hopefully see some more people going to treatment instead of incarceration.
What about educational outreach to the community to help them understand the power of this naloxone?
Yeah, naloxone. Absolutely. We do fentanyl awareness presentations, and we have combined our stigma reduction training with our naloxone training because they go hand in hand. I hear a lot of times people are worried about if they touch fentanyl, they'll overdose, and that's just not true. Oftentimes those officers in those videos are having a panic attack because it has to penetrate the organ of the skin. So if there's a cut or something, yeah, you could have some fentanyl in your system. But usually it's safe to help someone who's having an overdose. And we prescribe a lot of opiates to the elderly population in Kerrville. And so it could happen to an older person at an HEB. Carrying naloxone is just, it's a good thing to do. And it's best to keep it on you at all times because it works less when it gets hot. So best not to leave it in the car.
So we have three large employers in Kerrville and Kerr County. We have James Avery Jewelry, we have HEB and Peterson Healthcare. Have any or all of those been supportive of your outreach efforts through their foundation or other work?
Working on Peterson, really want to get some recovery coaches to be able to go in there when someone is there for an overdose kind of event. We would like to intervene and get them access to some services so they don't have to keep coming back to the emergency room. We have our cards in there. The nurses give them out when they're discharging some people. We'd love to see a Barney in the lobby of the Peterson ER. That's a 24-hour location. Those are the best locations.
Where do you hope to take this program? Just additional education, more naloxone, or in a different direction?
We are working on expanding. We're doing a presentation in Bandera coming up soon. They have a community center. So any county outside of Kerr, really, we can operate in Bandera, Gillespie, Kendall, and Bandera. Is that its own county? No. It's Medina.
Medina County.
Yeah. Medina, Kendall, Kerr, Gillespie. So, yeah.
So, Clayton, this is your first visit to our happy group here, the Texas Hill Country Podcast Network. And this podcast is the Hill Country Podcast. So maybe you could take some time to introduce yourself to our audience. Tell us a little bit about your story and what brought you to what you're doing now.
Like I said, my name is Clayton Evans. I was born in Kerrville and raised in Ingram, and struggled with addiction my whole life. And since I was young, and I've gotten the opportunity with this company. I've been in and out of prisons and jails, and the stuff that it's inspiring what's going on nowadays. Because whenever I was young, and all the stuff that's available now, it wasn't available then. And like the naloxone, you know how many lives that can be saved like that? Because so many people were like freaked out when people would have overdose and get dropped off places. And this is like a total game changer. We're saving lives. And I had didn't have to this is a great opportunity for me to be able to help other people that are going through what I was going through. And it's just being able to do that, like walking into the jail when I've been there for so many times and so many things, and seeing people and that are know me from there, and they're like, "What are you doing here?" I'm like, "I'm here for the people that are here," and they're like, "I don't know," and I'm like, "That's what I'm here for." And just seeing the hope in people's eyes whenever you talk to them, and they realize that they're all just one step away, just head in the right direction, and we're in the business of getting people healthy and helping them stay healthy. And really, we all make decisions in our life, pivotal decisions, big decisions, small decisions. But if we can make the right decision in the right time, sometimes it changes your life. And I'm just grateful to be helping people make them decisions.
I'm very familiar with 12-step programs. I'm a big believer in 12-step programs. I've seen that work on me. So I understand a faith-based component of a 12-step program, and then your own personal accountability moving forward and working with others. Is that generally the type of program that you would help someone through, or is it a little bit different?
Our Hakata doesn't like we support on whatever avenue helped you get sober, whether it be the 12 step, whether it be something that you've dealt with in your past that you really just want to change. And not everyone, we're all different, every person in the world. And what gets you sober might not get you in recovery, might not get me in recovery. And that's our company really meets you where you're at. Now, I've been through a bunch of different recovery things. And I will say that the 12 step has saved millions of lives. And I personally, it was I guess you could say a foundation of my sobriety, my recovery journey, because it helped me relieve the trauma that I had been through. And people don't realize how much trauma that we use substances to cover up. And I have been studying this, and I've gotten educated because of the field that I'm in now. And like the dual diagnosis is so big, because you can get in recovery, you can get clean or whatever you want to call it, and you still got the problem. You got the addiction problem, then you got the mental health problem, or the reason why we were doing the stuff in the first place. And it's so big that because you get sober for so long and then you're clean, and then you still got this problem over here. And that was the whole reason for the whole thing in the first place. And then you're back where you started. So I think and like MHDD and how their uptick, I think that you got to deal with both problems, or you're just stuck in the same situation that you were in the first place.
Anything to add?
Absolutely. Treating both the substance use disorder and the mental health condition at the same time is more effective than doing one and then the other. The research used to show that we treat the substance use disorder first, then we get to the mental health stuff, but they're so connected. We're getting better outcomes when we treat them both at the same time. We have an amazing partnership with a provider called Recovery Medicine, and she's in Ingram, and she's an addictionologist. That's hard to say. And We're making a lot of referrals over there to get people started. We can get people started with their first appointment and their first prescription, because sometimes people need a little help transitioning from using substances to not using substances. And maybe they did have an underlying co-occurring disorder, but it takes a specialist, I think, to really unlock the symptoms and find a good diagnosis. A lot of people are misdiagnosed when they go to inpatient treatment, because sometimes certain conditions and trauma look almost the same. So a lot of people come out of those institutions with this looming diagnosis of a mental health condition that maybe was just trauma. Yeah, we're really excited about being able to help people get medication for their opioid use disorder or their substance use disorder or for the co-occurring.
Clayton, I've had the opportunity to visit with Abby several times over the past couple of years. And one thing she has talked quite passionately about is helping younger women or girls to essentially what you said, make the right choice or don't make the wrong choice, maybe. But these are typically teenagers. Do you have the opportunity to speak with teenage boys or young men about that same topic of making the right choice?
That is a good thing about my company. I work under a T-Tour grant and I can help people because I'm a recovery coach. Anybody from 14 to 17 that I can help. And there was a lady, her nephew, he was going to school. He was 16 and she couldn't get anybody he was already on this stuff and got 7-OH and the kratom and all that. You can get it at stores. You got these kids that are getting older people just like they used to get beer to buy it for them. And next thing got these kids that are strung out that are out there and they got this problem already. And she called and she was like, my nephew, he's having a problem and I need someone to talk to him because he don't understand. And he has not had a father around or nothing like that. So he came in and I talked to him and he told me before he left, he was like, I usually don't listen to people, but coming from somebody that has been through a lot of stuff and I see that you know what's going on and you've been there. And so my greatest advice to everybody out there that have kids and stuff, just listen to them and just be aware because so much time we get so involved with other stuff that we don't really pay attention and a lot of stuff's going on. But through my grant, I've been able to work with kids and that was the only kid that I've actually dealt with. And it was real great because I actually felt like I don't know for sure if he will use the information I got, but he will get it. And that's basically what we do. We can give a lot of people stuff and what they do with it is theirs, but being able to offer it is the main thing. And it feels great to me because my daughter goes to Ingram School and our company, they got the youth prevention that goes into the schools and they're teaching all these kids about decision making, how important it is right now when we never had that when we were young. So this is vital. And this is having an impact on kids' lives that are like coming on these decisions because when you're in school, the pressure's on, the peer pressure, and you got these kids that are doing this, and you're hanging out with people just to be cool sometimes. And next thing you know, you're pulled into something or whatever it may be, but they're getting equipped with knowledge to handle these situations more efficiently.
Let me change the focus just a little bit because this has been on my mind. There's a guy named Brendan Sorsby, and he, until today, was the starting quarterback at Texas Tech.
Oh, no.
He has a bad gambling problem.
Oh, no.
And this Texas Tech is his third school. He's a great quarterback, makes a lot of money in NIL. But at his last school in Indiana, he was spending $70,000, $80,000 a year on gambling. And he was betting on games he was playing in, which is about the worst you can do. It's clear to me he has a gambling addiction problem, which I view as a mental health issue. But the question is, up until today, was whether or not he should be allowed to play football going forward for Texas Tech. So on the one hand, you want to have obviously personal accountability. And he's gone to rehab for his issues, but the NCAA suspended him for the year under sort of a disciplinary approach. Yes, we respect your recovery. We'll support your recovery, but discipline and recovery are two separate things. You have to be penalized for breaking the rules, which he did. He went to court and got that suspension overturned. And today he decided just to ditch the whole thing. He's going to go pro. And so he thinks the problem is going to go away. He doesn't, I don't think, appreciate what's going to happen when he gets to the pros. But I say that all by way of introduction to ask, how can you, I was worried about him playing and actually betting on games and nobody knowing about it except him. So the integrity of the game could be questioned. But how do you help someone? He's 21, he's got a lot of money, maybe not $1 million, but a lot of money. So paying his debts right now is not a problem. But how can you, I guess maybe this would be a great question to start with you, Clayton. As a coach, how do you help him to get through the mental health aspect of a gambling addiction and stay on the right road if he's committed to his recovery?
First of all, what I would think is, or what I like to say is that addiction or the problem that you got is not always drugs or whatever. And so first I would ask him to check, to just realize that he's got a problem, and is admitting that you got a problem is a big thing no matter what. A lot of people never get help because they don't really even see that they've got a problem. And I was more addicted to the lifestyle. And so you don't even realize that with that addiction that something else comes on. So I would like to find out, what I would do my hardest to do is get him to realize that the problem that he really has, and that there is help for it, but to get to realize the situation that he's in. That's what I like to get people to do. Write everything down that you've going through right now, and you've got the negative on this side and you've got the positive. This negative side's not getting you anywhere. So you got to cross them out, but you don't just cross them out. You got to add another positive in that situation, because you can't just take stuff out, because then you're left with a gap. So you got to fill it with something. And so I would do my best to help him realize the importance of what's going on, and that if he can see that he has a problem, because I'm not gonna lie to you, more than likely he doesn't even realize that he's got an addiction to this. You know what I mean? Because it's not like something, oh yeah, that's a drug where you're addicted to it. No, he's got a gambling addiction. And the more that he can see that he's got a problem with that, I think the better off that he is with dealing with that. But another thing is he's got to want to, because you can do whatever you want to help somebody out, but if they're not willing to put in the work and to change that, then it's not going to be changed. And that's just the honest truth. If you're not willing to do something about the problem that you have, then there's more than likely it's not going to be a change.
Abby, you've talked about your lifestyle previously, and there's certainly been lots of examples of musicians or actors who continued in that profession after they got clean and sober. For me, I really had to divorce myself from the lifestyle I was leading before I sobered up. Do you have to divorce that, or is that really an individual choice that one makes to leave if required?
So, performing in bars for years and years, getting tipped in liquor, getting paid in liquor, that had to stop. I do still make music because it's part of my everything. It is my recovery, it is my coping skill, and it was always that way. There were years I just slept in bed even with my guitar, because it was my songs kept me alive, I think, in dark places throughout my youth. So it took me a couple of years to come back to playing music. Truthfully, I just did it in church for the first 2 or 3 years of my recovery. And then I got to a place where I'm like, okay. People started asking me, can you sing here? Can you do this? And I said, okay. And it does bring me real joy to perform my original music. So I am doing that more. I just do it in shorter increments. I talk about my recovery on stage. It's an opportunity, actually, to promote recovery. So I do it now more regularly, but I'm very careful about where I do it. And I'm very careful to not promote the alcohol behind the bar, so I'm not the most popular probably. I just sing, I play music, and I do that for myself, and I do that to spread joy. So I would say it's changed a lot. But yeah, I'm still doing it. And I think if this person, it's all the same disease pretty much. It all acts on your dopamine reward system. It's a disease of reward pathways. So yeah, he does have to want to get better. He does have to admit he has a problem. And he's so young that I don't know. We'll see how it goes. But it's usually some kind of a void. It's a God-shaped hole in most people's addiction. That's usually kind of where it stems from, is this kind of spiritual lacking, trying to fill the void. So I would say, what are you running away from? What is the gambling really solving? And how is it helping you with your life? Because I've seen actually people get off of substances, but they're right there with their phone, and that phone can gamble all day, every day if it wants to. And it's dangerous. It's dangerous.
As I mentioned, we're recording this in June. Are there any things about the summertime that, from your experience, are particular triggers or that people need to watch for, or parents need to be aware of when their kids are out of school and they may be under more stress? Anything about the summer and around addiction and recovery that we could communicate?
I think sticking to a routine, having a routine, especially if your kids are off school, making time to spend time with them, being intentional about what's happening in their spare time. And there are a lot of awesome community events happening everywhere. So I think getting people out and about, there's something at the Arts Center. We have a Smithsonian thing in town. I think focusing on these kind of positive, healthy activities is going to be really great. There's something June 28th at Louise Hayes from 6 to 7. It's called Prayer in the Park. And just getting out and about and yeah, spending time with family, I think is really helpful because there might be teenagers, they get up to some stuff. Probably not allowing social hosting if there are parents who let their kids drink at home. That's pretty normalized around here, I'm sure, because I did it when I was growing up around here. So I know that it happens. And really, that's more dangerous. You know what I mean? None of it's good, right? But talking to your kids, giving them healthy options for positive activities is going to be important. Relationship building, that's what I would think. Connection can really help people who are struggling.
Clayton, how about from your perspective? Anything about the summer that you would tell people to just be aware of or cognizant of or keep an eye out on themselves?
Like I said, I started drinking when I was real young. And one of the main things I would say for parents is be aware where your kids are at. And not only that, who they're around. Because the summertime and we tend to let go. And okay, they're just having a good time. It's great to be aware of what is really going on in their lives. And summer and the river and booze is like a big thing. It's like it's something that's ingrained in our brain. But I don't have now I just get a water and it's crazy because I love drinking water. And so I guess I replaced that with water. And I really never knew what it was like to be sober and free because I've been a lot of my time incarcerated, but you can have as much fun on the river with a water as you can in the river with a beer. You know what I mean? And plus you don't have to worry about drowning or you don't have to worry about something happening or catching a DWI or something. So I would say just try to that's the most important thing. Like change that stigma to where let's make a change to where it's not the river and beer, it's river and Gatorade or water or whatever is healthy for you, or you know what I mean?
Clayton, unfortunately, we're near the end of our time for this episode. But before we leave, I wanted to ask you if our listeners wanted to find out anything more about your service, what would be the best place for them to go or way for them to contact you?
I work in at Hecata in Ingram, Texas. I don't know the number for there, but it's 102 Business Drive, and it's Kerrville, Texas, actually, but it's right off of Goat Creek. And just look online and get it up, or call our offices, or my own personal number for the company is 830-459-0897. And we're recovery coaches, and we're there to help anybody. If you got a problem, whether it be outpatient, whatever you need, if you need someone to talk to, if you need just whatever you need to get where you want to be and to stay healthy is what we do.
And how about you, Abby?
Yeah, they can call the front desk 830-467-3667. Oh, I hope so. CADA.org, HCCADA.org, Hill Country Council on Alcohol and Drug Abuse. We're getting it changed to awareness from abuse because we love to promote words that are healthy. Yeah, we would love to see you. You guys can walk in anytime or give the front desk a call. We're there Monday through Friday, and we'll be out and about at community events. If you would like a table, if you would like a presentation, please give us a call.
Guys, thank you so much for taking the time to visit with me today. I hope we can continue this conversation.
Thank you,
For sure.
Tom.
Thank you for having us.
All right.
It's been a pleasure.